We are now live. My light is a little bit blurry. Hi, everyone. Good morning. Good morning. Good morning. This is Dr. Echefu. So we're gonna be starting our live today. Yes, Dr. Desai is here. So I'm gonna be adding Dr. Desai. See, let's see. Hello. Hi, Dr. Desai. I don't know why my lens is so blurry. I'm like, what did I do? I have cleaned it multiple times. It's still blurry. I don't know what's going on.
No worries. I keep knocking over my camera, so if that happens, I'm sorry.
It's okay. It's okay. How are you? You look good. I love your hair.
Thank you. I'm great. I love your hair.
Thank you. Let me give a little bit backstory. And I love to give a bit how I met my, guest and all that. So, went for the TED event, I know, and I saw you giving with some other physicians too, and other people that use TED. I think so. And they were talking about TED. I'm like, you actually be a very good person to talk to about TED. I wanted to have the discussion with you. I'm like, no, I want everybody to know about TED. That was why I was like, you know what? I'm just going to invite her on my show so that she can talk about it, so that everybody can, be more aware about TED. Because I don't think a lot of people are aware about this TED hair treatment.
I agree. It's funny. There's so many people who said they've found me through intensive research, and it's strange because I feel like everyone should know about TED and they advertise for it, but maybe not well enough. So I'm glad to be here. Thank you for inviting me so I can
Thank you
talk
so
about
much.
one of my favorite things.
I know. Let me tell everyone now, you need to bring your paper and pen. I have my pen, I have my paper. So if you're not with your paper and pen, I mean, you're gonna be missing a lot. I mean, the video is gonna be here, but still, it will be nice for you to, have all jot down the most important points. So, the
Absolutely.
important, yes. I know you, but
Yes.
I want my audience to know who you are because I know you are loved. Let me tell you something a little before we start too. People have called my office to know when the event is.
Oh,
People have sent me a message, like,
okay.
about the event. So I'm telling you, there are a lot of people who are expecting today's, show. They're expecting to learn a lot.
That's wonderful.
Yeah, yeah,
So
yeah.
I'm Shraddha Desai. I'm a dermatologist in the suburbs of Chicago, fellowship trained in aesthetics and dermatologic surgery, and also a hair loss sufferer myself. So it's of interest to me.
Okay, that's good. So where is your clinic located at?
So it's in Naperville, Illinois, which is one of the western suburbs of Chicago, approximately 30 miles west.
Okay, that's awesome. That's awesome. So since you say you're already struggling with hair loss, so tell us a little bit about your own just personal story, just a brief, like, even with 5 minutes, like, or five
Yeah.
seconds. Tell me. Yeah.
So I am 43 going on 44, and if I think back, I believe I started to notice what we call telogen effluvium, which is a stress-related hair loss where you get massive shedding, almost 50% of your hair being lost, which you eventually grow back over a long period of time, starting probably in my mid 20s. So, whether it was med school, college, whatever, I noticed it would thin and then it would come back and it would thin and come back over and over again. What I didn't realize is I was also getting hit with what we call female pattern hair loss, where this front part starts to thin. We still have a lot back here. But when I look at both my mom and dad, they have it pretty strongly. I just, you never think that you're going to have the same issue. So I feel like I'm getting double whammied with both. And I've tried pretty much everything under the sun, shampoos, supplements, PRP, TED, red light
Mm,
therapy. The only
yeah.
thing that I don't take is like minoxidil because I'm just not ready to go there. The oral form, I mean.
Yeah.
So I get it. I get how frustrating it could
Of
be.
course.
I get how, it's embarrassing. Sometimes you see that bathroom light shine on your head and just like, why do I see my
Why
scalp?
do I see my
What am I
scalp?
going to look like in the next few years?
Yeah. So what do you tell people that are mostly frustrated? They've tried everything. Like, what do you really tell? Because they're like, I've been to a dermatologist, I've tried this, I've tried that. What is one encouraging word they can actually give to people so they can rekindle, the fire of just taking care of themselves, like taking care of their hair? What is one thing you usually tell
Yes.
people?
So creating a healthy scalp environment is extremely important, and a lot of times we don't realize that we're doing things that are not helping us, right?
Mhm.
Using certain products in our scalp, causing hair breakage, tight styles, things like
Yeah.
that. You've already seen a dermatologist, but if they haven't done a biopsy, which most people don't want to do, I get that.
Yeah. Yes, a lot
Sometimes
of
you,
people.
yeah. Sometimes you need that extra oomph if you're really like, what is going on? What kind of hair loss do I have? The only way to really confirm that is through that diagnosis. Now, let's say you've had all that stuff and nothing's really worked. I do think that PRP and TED would be great options. And if you don't mind, I can kind of go through what they do or.
Yeah. Yes, I don't mind.
So PRP, it's been around for quite a bit of time. It's where we draw your blood in the office and spin it down, get the platelet-rich portion, which has a lot of growth factors in it, and then it's injected back into the scalp where you have the area of loss. The idea is to sort of improve blood flow, get these growth factors and nutrients to all these dormant hairs, and tell them to start growing. Because right now they're just basically hibernating. They have no
Yeah.
interest in growing for you. How TED is different, and I want to explain why it's called TED. It stands for Trans Epidermal Delivery. It's a very fancy term, but the idea is to get a product from the surface of your scalp into the deeper layers of the skin through some sort of either energy mechanism or changing the quality of the surface of your skin. So in our case, we're talking about TED, it's using low frequency ultrasound. It's just ultrasound energy. Basically shakes up like the top layer of your skin cells. It creates little, we call them channels in the skin that allows this product, in our case it's a hair serum, to go into the scalp. Why do we care? Well, if you've got things on the surface of the scalp, the biggest issue is we can't get good absorption. Your scalp is there as a barrier. Your skin is meant to keep things out. We have to sort of modify it to bring things in. And that's what we want to do. Why I like it is because, unlike PRP where you have to have injections, and most of us don't like injections and it's
Yeah.
uncomfortable,
Yeah.
TED is very comfortable. It feels sort of like a hot stone massage. Um, and similarly, it's people always ask me, what is in the TED serum? And it's a combination of growth factors, peptides, and amino acids. There are no hormones in there, but they're doing similar things to PRP in terms of improving blood flow to the scalp, also bringing in growth factors to grow the hair. But one of
Mhm.
my favorite things about the TED serum is we have these retention peptides, which
Mhm.
anchor your hair in place. I'm a shedder, as I said, I go through this shedding loss quite frequently. And
Mhm.
when I hate to grow a hair just to lose the hair. So
That's the
I
good
love
to
that it's able to anchor it and I don't
have.
notice as much shedding as I
Yeah.
normally would.
That's right. So now I know people want to know. So what is the three selling points for TED hair restoration? So if someone comes to you now in your clinic and says, why do I have to go with TED instead of the PRP that I hear people talking about? Why? So what
Yeah.
are your three selling points?
So I would say pain-free. That's a big one for a lot of
Yes,
people.
yes, yes.
Consistent. What I mean
Mhm.
by that is PRP is amazing, and so many people do great things with PRP. But some people get really good results, and some people get no
Yeah,
results. There's a very
that's right.
wide range of who responds.
That's right.
Whereas with TED, I feel like I can shorten that window to I can for most people say you're going to get somewhere between 30 to 50% increase in your hair density. So that
Okay.
consistency is a little bit better for me. And then lastly, I think it's to help with the hair shedding. That's something
That
I
would be
haven't
extra.
seen with PRP.
That's right. Me, I always say it's just a lunchtime treatment.
Absolutely. You don't have to
It's
do
like-
anything special to be there. You just have to have a clean scalp.
that's what. Okay, so now I know everybody want to know. Um, when do you go with which? When do you decide to say, hey, I think this is what you need to do, Ted? Instead of
Mhm.
trying, is there like a deciding point where you have to say, okay, this is what you need. You need to go with Ted. Is
So
there
I
like
like,
a?
yeah, I really like to have our relationship be a relationship with the patient and myself. So
Mhm,
when we have the discussion about hair loss, I will start with everything, including topicals, supplements, anything that we can do based on what
mhm.
they're seeing. I kind of do compare one to the other. Um, in my office, I'll be honest, I haven't done PRP for hair loss in about 2 years. And
Wow.
I had a lot of PRP patients. However, they would look at our banner and say, hey, you have something else. Even though I've been doing well with the PRP, what's that all about? And so I'd
Hmm.
say, we have this other option. You've been doing well with PRP. I don't know if it's going to do the same for you, but if you were willing to try, happy to switch you over. And what's been interesting is they've obviously it feels better, but a lot of them will say they've gotten better results than they had with the PRP.
Therapy.
So that
Okay.
was a surprise to me, honestly.
And now, do you have to do the TED hair restoration? Do you have to do it all the time, or is there like how many times do you have to do it in a year? And do you
Yeah,
have like maintenance therapy, like or is this something you have to do for the rest of your life?
absolutely. So unfortunately, we don't have a cure for hair loss. That hair loss cycle is so complex that we only know the tip of the iceberg of it.
Yes, sir.
And so I tell patients, and what I think is important to note is that TED is really, really good and geared for pattern hair loss, meaning male and female pattern hair loss, androgenetic alopecia. It also helps with that COVID hair loss or that telogen effluvium, we call it. But if you have another type of hair loss, like alopecia areata or scarring hair loss, it's not going to be the right treatment for you. So it's very important for you to get an appropriate diagnosis before you go and do this. With TED, you're right. It's a kind of like a loading dose, I like to call it, where most people are doing somewhere between 3 or 4 treatments spaced a month apart. And then maintenance is usually once every 6 to 9 months. I used to say once a year, but I felt like people lost a little bit of their benefit at that 11 or 12 month mark, and I don't want that. So we like to keep them on the upward swing. So
Every six
somewhere
months.
between 6 to 9 months, I think, is appropriate. Now, there
Okay.
are there are variables to that. So like I told you about my type of hair loss, I do mine quarterly because I know I'm going to do some weird diet and lose some hair, or not eat enough protein or get stressed
That's right.
out, lose some hair.
That's right.
So I like to be more consistent, but you don't have to.
You don't have to. Okay.
Yeah.
So basically, so is there any contraindication to TED hair treatments?
Yeah, so contraindications would be things on the surface of the scalp. For example, skin cancer, psoriasis, discoid lupus, or infection on your scalp. If you have a fungal infection, those are things we don't want to treat. I also think if you had like head and neck cancer, a history of
Mhm.
it, we probably don't want to be introducing growth factors, just
Okay.
theoretically.
Mhm.
Um, Outside of that, I might ask you a question. You're a hair transplant specialist. Do you have a preference on when we start TED? Like some people want to do TEDs after they've had a transplant, and I've been waiting 6 months, but I
Yeah.
would prefer to defer to the expert.
Yeah, you wait 6 months. You can
six
do
months.
6 to 9 months. It doesn't matter. So sometimes I do TED, 2 treatments, then do hair transplant.
That's smart.
Or if people have done hair transplant before at other clinics or travel, then I do the head hair restoration. So it depends. So
Gotcha.
so it doesn't really matter. You just have to wait 6 months. It's just 6 to 9 months.
Okay, good. I was doing it right.
Yeah. Yes, you've been doing it right. Yeah. So that's it. So you're saying that so if they have psoriasis,
Mhm.
lupus, any form of infection, so they need a proper evaluation. Not everyone qualifies for TED hair treatment. That's what you're saying.
Correct. And specifically on the scalp. So if you had skin cancer on your arm, you're totally fine to do a TED treatment. If you have psoriasis on your elbow and you don't have it on the scalp, yes, we can treat that area. If you have lupus, like the scarring type of lupus on your scalp, I probably would want to avoid that because it's
Avoid them.
really what's happening on the surface that's important to us.
Okay. So there's never a point in scarring alopecia that will say, hey, I think this is stable. Like, can we try the TED hair treatment or is a hard no?
So that's really a great question. We have a wonderful colleague. Her name is Dr. Lady Di, who does a lot of hair loss, and she treats a lot of scarring alopecia. And we always thought that there was really no hope for these people, and it was honestly a hard
Mhm,
conversation to have.
mhm,
But what she's found with TED is that by doing the treatments before it's in the quote unquote burnt out stage, if it's not just scarred and no hairs in the area, if you treat with TED, we are able to see a very nice closure of that area of hair loss. In the area where it's the worst, you may not see it fully grow in, but you'll get enough hair around it to cover the spot. So I think it's worthwhile. If you have long-standing scarring hair loss, the possibility is low that it'll grow, but I do think it's worthwhile to try for some of those who are just in the beginning stages of it.
Okay, okay. So it's total. What about just a little bit microneedling? What do you think microneedling with TED?
So we've tried that. I think the hardest thing is with microneedling, you get a lot of serum and a little bit of blood that comes up, and we're trying to drive the product in.
Yeah,
So I feel like a lot of times it still continues to come out of those channels,
yeah.
and that's
Hmm.
my only concern. Is like, is it
Hmm.
really going in and staying in, or is it coming back and sitting on the surface? Plus, the same thing, a lot of our patients don't like pain. I will say, since we brought on TED, the number of male patients I've had
That's why.
is exponential.
I probably see. Yeah,
Right? And
yeah.
they said, I wouldn't have come if it was painful. And so this is exciting. There's an
Mhm.
option
Yeah,
for me now.
awesome. Yeah. Okay. So now what about in terms of, is there like ethnicity wise, is TED only for a specific, group of people or anyone can get TED hair treatment? Because we need to, address this part too.
Yeah, so no, that's really great. When I first got TED, I treated, I think, about 15 patients, aged like 16 to 80. My dad was 80, and literally every ethnicity you could think about. We had Indians, Asians, African Americans, Caucasians. No, everyone responded. No one had
Mm,
any issues. I know with ethnic hair, it
mm,
tends to absorb the serum quite a bit. So we just warn the patient that they're going to have a lot of tight curls immediately
mhm,
afterwards, but it doesn't break the hair and they still
mm.
get just as good of a result.
Okay. What about, so now after getting the treatment, is there like any special treatment after the TED treatment? Like what's your clinic, get the hair treatment, is that it? Or like something, anything special we need to do?
Yeah, so coming in, we ask that you have a clean scalp, meaning shampooed, conditioned,
Mhm.
no gels, hairsprays, all those kinds of things, because we don't want to push that in.
Yeah.
Afterwards, it's going to look like water as it dries in your hair, so it's going to be a little
Mhm.
damp. You can wear a hat if you want to. You can
Mhm.
blow dry it. We ask you not to get it wet for at least 12 hours.
Okay.
I'd prefer 24, but
24,
if
yeah.
you can do it 12, give me at least that. The idea is if these channels are still open and we still have a little serum left on the scalp, we want them to be able to be absorbed. So we don't want it to wash out. So that includes sweat. Don't get
Okay.
your treatment and just go, run.
Okay.
Just take it easy.
So now the reality of everything is that some clinics that are not physician clinics also have TED, and that's
Yes.
it. So how will you advise someone to in choosing the right treatment for them? You know, like should they just go ahead and do the TED hair treatment, or they have to have a proper evaluation first?
I think it's important, regardless of who you are, to get a proper
Mhm,
evaluation first. We still need to make sure that this is going to work for you because it is an investment and you don't want to waste your
mhm,
money. The
mhm.
good thing about TED is it's not going to hurt you, but we also want you to get the results that
The
you're
results that you're
looking
looking
for.
for.
I still think it's appropriate. So let's say I didn't have TED, but I'm your dermatologist. Let me do your evaluation and say, yes, you know what? You have female pattern hair loss. These are your options. And then if you wanted to go to one of these med spas and have them do that treatment, I think it's totally appropriate. The device is a class one device, so anyone can use it. So you don't have to worry about Are they doing it improperly? I just want to make sure that you have the right diagnosis so that it's going to be effective for you.
Effective for you. So it really doesn't matter. The message is you have to get a right evaluation, and because you actually want you want to see the results that you're actually getting the treatment for. So
Correct.
that is the main. That is the main. Okay, that's right. So do you have any specials coming up in your clinic for TED restoration? Do you have anything going on that you want us to know? Because
Well,
this is how we spread the news.
I don't have any specials, sadly. I speak about TED quite a bit. I do speak for Alma, who makes the device, and so I'll be out in Scottsdale at the Fairmont Princess next weekend. If you're interested to hear more about it, I can go
Okay.
into the nitty gritty.
Okay, good. Going into it. And not okay. So in you said Scottsdale, Arizona.
Hmm.
Okay, that's fine. What about the audience? How can they connect with you again? Like, I know we talked about from the beginning, but how can they connect with you again?
Yeah,
Like,
so you
your
can
clinic, your
find me on
website.
Instagram at SDeciMD. If you click on the link, it links you to my webpage directly for our group, and so I'm happy to chat with you. And if you are interested in knowing if there's somebody in your area that has TED, depending on where you're located, you can actually go to almainc.com and search TED, and it usually tells you who the providers are in your area.
Okay, so dot what
And
dot
then
com.
you can search for TED.
That's
Yes.
right. Okay, that's right. That's right. That's right. Yeah. So you see, everyone, she talks about TED, you know, and one more question I get about TED is that is it expensive? How expensive it is compared to other treatments, hair loss treatments?
Yeah, so we price it the same as our PRP, and that price
Mm-hmm.
hasn't changed in
Hasn't
6 years. So yeah, because we've done PRP for a very long time, and when we brought on TED, we thought we should probably do the same amount, because we weren't sure what our results were going to be, and it's done so much better, but we kept the price
changed.
the same.
Okay, so basically the same price, and if you've had PRP before, you expect the same amount range of price,
Correct.
Okay. Thank you so much, Dr. Desai. Thank you so much. I know I'm going to have you again. I just wanted people to know about this TED hair restoration because I get so many questions on this, and I just want someone that's well knowledgeable, to come talk about it. I use it in my clinic too, and it's been a lifesaver for me, especially with PRP and all that. Because I've
Yeah.
had people that come in that have had multiple, that have PRP.
Hmm.
So we try to go with TED, and we see results, and and that's it. So thank you so much.
Thank
Thank
you
you
so
so
much
much.
for having me. It's always nice chatting with you.
I know. Thank you so much. Bye bye.
Bye.
Bye everyone.